This video is a self-assessment for hip flexion, and so this is hip flexion in regards to mostly something like a squat or a clean. So for standing hip flexion, that's one way that you can check it. You want to make sure that you keep your back neutral and you're going to lift your leg up as high as you can. You can also kind of pull it in, making sure that your back does not bend and let go, and see if you can hold it there. So it's always going to be a little bit higher than when you can, what you can do by bringing it up yourself. But you kind of want to test both of those out, and see about what you have. And so what you're looking for is like, how high is this angle? Like, do I have a lot of active hip flexion? Basically means you can support the joint in that position. So if you're doing lots of heavy squats and you have really, really bad active hip flexion, maybe you can get down really, really deep in your squat, but you can't actually hold your leg up very high on your own. It would be better to not squat quite as deep and work on improving your active hip flexion. Another way to test that is laying on your back. And so for this one, you can keep your hands underneath your back just to kind of see how far you can pull your legs up without pushing your back into your hands. So as soon as you start to feel your back pushing into your hands, that means that you're kind of done, that you've hit your active hip range limit here. You could try to pull a little bit deeper and see, but again, you want to make sure that you're not moving your back. Okay? So that is a sort of squat-centric hip flexion, and then if we're using this as an assessment, we will give you the tools in the mobility segment to improve that active hip flexion.